Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are happy to welcome Dr. Kathryn Retzler, a physician, author, educator, and owner of HormoneSynergy, a concierge age management practice. Welcome, Dr. Retzler. Can you take us back when you were first beginning your career in medicine? Tell us about your experiences as a new clinician and how those experiences guided you onto the career path you are on today.
Well, when I was in school, and this was, going back 25 years ago, because I've been practicing for 20 years now, I had a lot of patients coming to me who were struggling with hormone issues. I ended up doing my thesis on sleep disorders during menopause because I wanted to understand what was going on for women during that transition. And so that really inspired me to learn more about hormones in particular. I also had a mother who struggled hormonally, mental illness wise. And so, I think a lot of physicians probably go into medicine to try to heal their family or the people they love, and we're inspired by our own experiences. So that definitely was an impetus to go into more holistic type of medicine and also treating the cause.
When did you first decide to start your own clinic?
Oh, well, I decided to start my own practice right after my residency. As a naturopathic physician, we don't have a whole lot of options. We have to be entrepreneurs and start our own practices because there aren't a whole lot of opportunities to get a job, so to speak. So I opened my first practice in 2002. And what did I need to do to start my own practice? Well, I had to get clear about what it was I wanted to do, who I wanted to treat, who I thought I could help, and who I couldn't. And I think most importantly, I gathered a network of like-minded people. I started going to conferences. I think my first A4M conference was when I worked for David Zava at ZRT, and he sent me. So that's going back at least, I want to say 15 years. And, it was a very different world then in the anti-aging community. I mean, it was much smaller, but there was definitely a lot of support in the like-minded thinking about age management and how to help people age well. So that was definitely really important in terms of not just starting my own practice, but developing a level of competency and a referral base.
How do you define hormone synergy, and why is this approach so important to health and age management?
Well, the word synergy, the reason I chose that as the clinic name was because it refers to the idea that the whole is more than the sum of its parts. And I think that's true for just functional medicine, holistic medicine, whatever term du jour we want to use, is that when you treat the areas of health that are out of balance, you get a result that's greater than any specific area of treatment. And obviously I do more than just hormones, even though I chose the term hormone synergy when I started my practice. And when I wrote my very first book, I chose that term. And at the time, Suzanne Somers had just published her book, and people were very interested in learning about hormones and learning how hormones impact health, et cetera. So that's how I would define synergy. But it's also why I chose that name as the name of my clinic and the first book I wrote.
How do you see the role of sexual health within overall wellness throughout the lifespan?
The book I just published in March is called Sexual Security, The Aging Man's Guide to Optimal Aging. And the reason I wrote that and the reason I chose that term is because men don't seem to care about how they age, about their cardiovascular health, about their metabolic health, as much as they care about how they perform sexually. So that's why I chose that term. We've been offering a treatment called GainsWave, which is extracorporeal shockwave therapy, since December 2017. So the reason I went to learn that was because I was doing a fellowship with Mark Houston, which I've done twice now because he's such a great teacher and there's so much to learn, on preventive cardiology, and men are not really willing to focus on that area of their health the way they are their sexual health and performance. So I went to learn GainsWave because I was tired of just writing PDE5 inhibitor scripts, and because I wanted to offer men a solution. And it also piggybacked with the time that I was learning about and implementing a lot of preventive cardiology strategies. So, it's really more of a marketing thing to get guys interested in what really matters more than it is a certain service that we're offering. Although it works. I mean, men pay attention.
What are some of the common misconceptions you often hear from colleagues, patients, and others surrounding the practice of age management?
Well, I'm glad you used the term age management instead of anti-aging. I mean, I think age management probably is now more popular than anti-aging, because obviously you can't stop aging. You can improve the aging process. I like the term enhancing health span versus just lifespan. But there are, I wouldn't say it's misconceptions. I would just say there's different ways of looking at it. So some people, they're looking for cosmetic enhancement, and that's oftentimes what the term anti-aging gets referred to. So whether somebody's doing Botox or injection therapy or, hair restoration or cosmetics. I'm not really as interested in that. I mean, we do PRP for hair loss, but it's in the context of a comprehensive approach to the causes of the hair loss and not just cosmetics, because I don't do that. I don't do cosmetic care, But I think there is a myth that anti-aging is all about the superficial instead of understanding, internal medicine, what happens to people, and focusing on that. Because I think there's also a myth that it's expensive. I think there's a myth that anti-aging medicine is for the rich. And that makes me sad, because I grew up with a single mother, and I never wanted to price myself outside of what the average person can afford. So even though I have a concierge practice, I still feel like most people can afford their cell phone and their Starbucks habit. And so if they could invest that in their health, it's going to pay off in the long term. So I think it's actually a lot cheaper to practice this type of medicine than it is conventional medicine, especially when you look at the cost of insurance and the expected cost that people will be paying, their burden of cost as they get older and sicker. So I think that's a myth too, is that anti-aging medicine is only for the rich and it's too expensive and that you can't afford it.
And last question. It's so important for clinicians to invest in their own health as well as their patients. How do you ensure you are optimizing your own wellness? And are there any particular practices or habits in your own life that helps keep you healthy and centered?
Well, I try to practice what I preach, and I'm pretty authentic with my patients. I think as physicians, the number one tool we have is ourselves, and patients will emulate that. So, I practice all the steps I outline in my book, except for I probably drink too much wine. So I eat very well. I spend about 2 hours a day on my diet and my husband's diet, because I make all of our food. I exercise every day. I meditate every day. And sometimes after 20 to 30 minutes, I want to start over. If I have the time, I do, because I love that state. I sleep well. I work on my spiritual evolution. And I prioritize my own needs. So, a few years ago, I got hit with a cosmic 2x4 when I had a health crisis that was definitely from all the years of not prioritizing my health. And I learned that I was a helpaholic and I was addicted to helping people. And so I kind of went through a major shift because of that. And I'm no longer as codependent with my patients as I used to be. I wish that was something I'd known 20 years ago. I wish that was something I could communicate to young physicians, because I think it's easy for us as help in the helping profession to become burned out and to become helpaholics, and then to pay a serious health price to be able to learn that. But now I think I'm a lot better at balancing all of those needs and prioritizing them, and then recognizing when those needs are out of balance and doing something about it.
Thank you so much, Dr. Retzler, for sharing your insight and your expertise with us today.
Thanks for having me, Lindsay.
And thank you to all of our listeners. Until next time.